Welcome to my vlog, Skills versus Capacities in the Weight Room. In this vlog, I will show athletes that lack either the skill to perform an exercise efficiently or they demonstrate a capacity deficiency. Upon analysis of each activity, I'll provide derivative exercises that will assist the athlete in performing the activity more effectively. In this context, a skill reflects the athlete's ability to control their body accurately, efficiently, and in a timely manner. Conversely, a capacity is the athlete's ability to express a given quality. For instance, the maximum force they can express or the range of motion at their joints. For ease of analysis, I've placed markers on the lateral epicondyle and lateral malleolus. I will also be using green for optimal and orange lines for suboptimal positions. As a novice lifter, Harry demonstrates a clear lack of motor control. He fails to control the tempo of his squat while also initiating the movement from the knee rather than synchronizing the squatting movement by flexing simultaneously at the hip, knee and ankle. Upon further analysis, we find that Harry cannot reach the recommended parallel squat depth, whilst also demonstrating the knee dominant squatting pattern, very quickly reaching maximum dorsiflexion. Orange lines showing horizontal displacement of the load outside of his base of support. By utilising incorrect descent mechanics, Harry has developed a forward lean from the torso, and while some forward lean is sometimes necessary to maintain equilibrium, especially when performing deep squats, attempts should be made to keep the trunk as upright as possible to minimise shear forces. From the rear we can see markers placed on Harry's PSIS, his posterior superior iliac spine, to see how much movement there is at the pelvis and if there's any asymmetrical weight shifting. Harry doesn't seem to have an asymmetry at the pelvis, but we can see some pronation of the foot, eversion of the calcaneus, and external rotation of the tibia. With this information and Harry's inability to reach the wall from 5 centimeters on the lunge to wall test, it would appear that he lacks mobility in the ankle joint. However, he is able to go below parallel with a pole squat, which demonstrates that, in my opinion, it's more of a skill deficiency rather than capacity. During this goblet squat, we see that Harry still utilises a knee dominant strategy, but by shifting the load to the front of the body, we see a more upright torso posture. However, there's still a failure for Harry to reach parallel. Introducing a box, I have changed the environment to ensure that Harry now initiates a hip hinge strategy, while also maintaining a more upright torso. In summary, the use of a heavier load is not yet applicable to Harry as he lacks the skill to perform the squat correctly. Therefore, while he is learning the skill, the load should stay minimal and he should work through a range where he can perform the exercise with correct form. I'd also provide him with exposure to lots of different squat and hip hinge patterns. If I had the option of using mirrors, I would have used these as they would have provided the athlete with a more external cue. By drawing a vertical line down the mirror, I would have asked Harry to keep the bar path on that vertical line. Our next athlete performing the high bar back squat is Finley. He demonstrates the difficulty to achieve full depth, possibly due to tightness in his posterior chain. He therefore utilises a forward lean strategy in an attempt to reach the desired depth. This increased hip flexion forces the load outside his base of support, increasing the moment arm at the hip, leading to increased lumbar shear forces that could result in injury. The back squat in the sagittal plane and tracking the PSIS to assess frontal plane stroke weight shift deviation, we can clearly see that in the bottom position, Finley struggles to maintain neutral. With an altered PSIS position and thus a weight shift, this will cause shear forces through the sacroiliac joint and also place the lumbar spine in a vulnerable position. The knee to wall test shows us that Finn lacks the requisite amount of ankle dorsiflexion. As an intervention to help increase mobility in the posterior chain and ankle complex, I have included slow eccentric loaded exercises to lengthen both the active and passive tissues. It is well known in the literature that eccentric loading causes an aggressive lengthening of both the musculature and the collagen fibers in the tendon unit. Complex, I've used heavy eccentric calf raises as this will help both lengthening the tissues and gain a significant strength response. For the posterior chain, I've included eccentric slow RDLs or hip hinge to lengthen the tissues at the hip joint, as well as latissimus dorsi and other key musculature. In summary, Finn lacks the capacity to reach a more desirable squat depth due to a lack of range of motion at the hip joint. Therefore, I have used derivative exercises with a view to improving length-tension relationships. We used 90% of Finley's 1 rep max during this mesocycle with a view to improving Finn's maximum force production. I would also use unilateral exercises in Finlay's program, such as single leg RDLs and Bulgarian split squats, to improve a possible bilateral deficit. The next weight room activity we're going to look at is the power clean. We see Finley again, this time however with a skill deficiency. Success with a power clean exercise involves complex and synchronized neural recruitment patterns and may provide a better impression of an athlete's whole body power relative to other resistance. When we look at Finley's power clean from a lateral aspect, we see that his bar path takes the bar away from the body rather than the more optimal bar path in green, which brings the bar back towards the body. The reason for the bar trajectory is because he is adopting a 1-pull strategy in favour of a more desirable 2-pull strategy, as he lacks patience in the first pull and also lacks an effective posterior knee drive. Here you see the knees move anteriorly as Finley attempts to rip the bar from the floor. The use of an isometric Romanian deadlift will assist Finley in recognising both the ideal body position to adopt for the first pull and also where to start the second pull. I've also included an isometric RDL to promote motor learning while also providing a strength stimulus at that specific joint angle. My second intervention is the hang clean, as this will simplify the movement by reinforcing the correct point at which to start the second pull, while also making him more confident in his catch position. To summarise, Finley lacked the skill to perform the power clean effectively, as he rushed the first pull without using a posterior knee drive to put him in a more advantageous position for the second pull. The use of 80% of Finley's 1 repetition maximum in the power clean was used, as evidence suggests this is the optimal load for peak power output. Our second athlete performing the power clean is Sean. While he has been training for a few years, he's still relatively new to Olympic lifting. In its next image, we see that Sean lacks the capacity to adopt a high elbow position in the receive. He also demonstrates increased lumbar extension, possibly due to a lack of thoracic extension. From the anterior view, we can see that Sean lacks the capacity to receive the bar in the more desirable high elbow position. Rather than give Sean passive stretches to provide more thoracic mobility, this may not transfer to his power clean, so I've decided to include 2 interventions that are more task specific. Firstly, to address any skill deficiency, I've included a power clean from the hang position so that the athlete can become more confident when receiving the bar. I've also included the use of front squats as both a disassociation exercise and a task specific way of providing thoracic extension. This will further expose the athlete to the front rack position while also providing a strength stimulus.